No. Well, I guess I should say something, right? When I was 10 years old, I knew I wanted to be a doctor, but there was really, for our community people, just like many First Nations and Métis people on Turtle Island, nobody graduated from grade 12, or there was no professional category. But I kind of knew that I wanted to do medicine, and I wanted to work for my people, because even at that time, like 50 years ago or whatever, the stereotypes that I heard about my community people was that the reason we were poor and the reason that we had health outcomes was related to something wrong with us. And I knew inherently and instinctually that I was wrong. That is my 50-year journey to today. And so I went into medicine. I didn't graduate from grade 12, although my grandkids do that. And then I won scholarships and top awards, and I got into medicine. I was never expected to get anything beyond digging ditches, like most school systems that people my age. And so I'm very honored to be here, and I'm very honored to work with MKO. In particular, has been an incredible experience for me. It's like my community people just elevate me and allow me to conduct the best research. They allow me to interrogate the systems to make sure that our rights to gain access to healthcare, especially this pandemic, and that's the fight we've done collectively together. So it's not all about me, it's about a real large number of very intelligent people in our communities. So it's not about me, it's about the people that I serve.
Absolutely.
And so that's it. And I am a Bear Clan member, and the Bear Clan member is about health and healing. That's the only way I got through, is because of my ancestors. Thank you.
Can I just ask one question? You've been really involved. Jeff, are you still okay to record?
Yeah.
You've been really involved, and MKO has been really involved through the pandemic of highlighting the disparities that exist for First Nations people. And this pandemic was kind of an opportunity to help Canada understand a little bit better. What do you feel are some of the outcomes that have come from your advocacy, MKO's advocacy, through COVID-19?
Well, I mean, you know, when you look at the systems, the healthcare systems, and I'm really speaking both to the province as well as the feds, what we did understand prior to the pandemic was that the gaps in care were related to not only policies or lack of legislation or lack of effective undertakings of healthcare systems. But what we realized when the COVID virus came is we got together and we kind of theorized on kind of what the state of was for First Nations and what this virus would do. So about 4 or 5 of us got together and we set out a plan to look for rapid response teams, both in terms of public health, but also in terms of any severe respiratory illness that would occur in our communities. And that took about 3 years of my life to negotiate, 3 months, to make sure that we had that type of support. So it required an integrated support across all systems, but it was First Nations who led that response. And then it was around testing, our early access to testing, and then our early access to vaccines. And our argument was at that point in time, because we knew about 50% of the people who were in ICU were identified as First Nations. And then when the provincial government came forward saying that they were going to give vaccines to nurses and doctors in ICU, my comment, and this is a recorded comment, was that give me the vaccines and I'll reduce the admission rate by 50%. You don't have to worry about your nurses and doctors. You just give me the vaccines and we'll come to our community. And so that logic and argument carried through, and to and including access to treatments for COVID. And what we realized is what this system here, with all the good people who come forward in the system is not prepared to address health outcomes for First Nations, and we have a lot of work to do still. And so now that we're coming out of the pandemic, although it still is in our communities, we have to do really, really assertive interventions to change the system to accommodate and improve life expectancy and health outcomes, and with a focus on racism in healthcare as well as harm reduction. And you got to remember that the consequences of 150 years of colonization is that we have some people in our communities who really, really need to attend to the harms that they've undergone. And so we're developing systems that are based on care, respect, as well as being First Nation centered and forgiving. But the consequences of white privilege in this system are that we suffer because of that white system. So my job as one of the soldiers to work with First Nations people, is to address that. And that's how it works.